Beyond Cholesterol, new lipid blood test, offers early detection for childhood metabolic diseases. Introduction. A groundbreaking study from King's College London reveals that a new blood test examining specific lipid molecules in children may offer early detection of future risks for type 2 diabetes, cardiovascular disease, and liver dysfunction. This research introduces a shift in our understanding of pediatric metabolic risk, suggesting that it's not just cholesterol, but specific types of lipids that may better predict long-term health complications. The new findings challenge conventional assumptions about the role of cholesterol and body mass index, BMI, in identifying metabolic disease in children. Instead, they point toward more nuanced lipidomic profiling as a promising tool to guide early intervention strategies. For families and healthcare providers, this could mark a powerful shift in how we approach prevention and personalized care for children at risk. Lipid molecules versus traditional cholesterol screening. Traditional screenings for heart disease risk typically measure total cholesterol, LDL, bad cholesterol, and HDL, good cholesterol. However, this study reveals that certain lipid molecules, particularly those involved in cellular signaling and inflammation, may offer more precise insight into disease risk. Researchers analyzed plasma samples from infants using existing hospital laboratory equipment and discovered strong correlations between specific lipid types and later health issues. These included elevated blood pressure, insulin resistance, and early signs of non-alcoholic fatty liver disease, NAFLD, all occurring independent of BMI or cholesterol levels. The key lipid families of interest were ceramides and diacylglycerols, bioactive lipids that have been previously implicated in adult metabolic disorders. These lipids appear to promote inflammatory responses, disrupt insulin signaling, and impair mitochondrial function, thus playing a direct role in the development of metabolic disease, even in early life. The role of lipidomics in pediatric health. Lipidomics, the large-scale study of pathways and networks of cellular lipids, offers a more advanced approach to understanding metabolic dysfunction. The King's College London study underscores how lipidomic signatures present in infancy could serve as biomarkers for long-term health monitoring. More importantly, researchers observed that children with elevated levels of these risk-related lipids did not always have high BMI, illustrating that standard obesity metrics might overlook metabolic risks in a subset of children. This highlights the need for expanded diagnostic criteria in pediatric care. The predictive nature of lipid signatures could allow clinicians to identify hidden risk in children who might otherwise appear healthy based on weight alone. These insights may be crucial in reducing future incidences of early-onset type 2 diabetes and cardiovascular disease, both of which are increasingly common among children globally. Metabolic improvements without BMI change. One of the most promising findings of the study was that lifestyle interventions, such as improved nutrition and physical activity, successfully lowered the levels of harmful lipid molecules, even when BMI did not change significantly. This reinforces the idea that metabolic health is not always reflected in body size, a concept that is gaining traction among experts in childhood obesity and endocrinology. Small lifestyle changes, including regular family meals, improved sleep hygiene, reduced sugar intake, and outdoor play, may offer metabolic benefits by shifting the body's lipid profile toward a healthier balance. These interventions may reduce disease risk at the biochemical level, even if physical changes in weight are not immediately visible. Implications for childhood obesity and related conditions. Childhood obesity has reached epidemic proportions worldwide, with more than 340 million children and adolescents classified as overweight or obese. While weight-based interventions are often used to address health concerns, this study supports a more comprehensive approach, one that targets underlying metabolic dysfunction instead of focusing solely on weight reduction. In addition to obesity and type 2 diabetes, elevated ceramides and other inflammatory lipids have been linked to non-alcoholic fatty liver disease, NAFLD, particularly concerning in children, as the condition can progress silently over years before symptoms arise. hypertension, and vascular inflammation. These lipid types may contribute to arterial stiffness and early blood pressure elevation, even in young children. Insulin resistance, a key precursor to both diabetes and hormonal imbalances. This lipid-centric framework may offer clinicians a more effective means of stratifying risk and tailoring interventions based on molecular indicators rather than BMI alone. The future of pediatric preventive medicine. With the availability of these tests on standard hospital lab equipment, early lipid screening could soon become part of routine well-child checkups. This could shift the paradigm from reactive to proactive pediatric care, allowing families to begin tailored lifestyle changes before irreversible health damage occurs. Looking ahead, lipidomic profiling could also support more targeted nutritional guidance, such as increased intake of omega-3 fatty acids, polyphenol-rich plant foods, and dietary fiber, all of which influence lipid balance and inflammation. Similarly, reducing processed sugar and trans fat consumption may play a vital role in maintaining healthy lipid signaling pathways. Conclusion. The identification of specific lipid molecules as early indicators of disease risk in children offers a powerful tool for transforming pediatric health care. Moving beyond traditional cholesterol testing and BMI measurements, this research supports a more dynamic understanding of metabolic disease and more effective strategies for prevention. By focusing on lipid profiles rather than body size alone, clinicians can uncover hidden risks, guide earlier intervention, and empower families to adopt healthier habits that benefit children at the cellular level. These insights mark a hopeful step toward addressing childhood obesity, type 2 diabetes, and liver disease before they take hold.